Welcome back, everyone. It's great to be back here again. My name is Dave. I'm with Lifetech Instructional out of Palm Harbor, Florida. In our previous videos, you should have learned adult CPR, child CPR, infant CPR, and adult choking. Well, here's another thing that goes with the CPR side of it. It's called child choking. With child choking, our age group is, like you're saying, between 1 to signs of puberty. In this day and age, signs of puberty is around 1 to 8 years of age. If a child is choking, you want to encourage that child to cough it out. Now, one thing that can help is have the child raise their arms up in the air and encourage that child to cough it out. Because by raising the arms up, it helps expand the chest. So as you're trying to do everything you can to, hey, cough it out, buddy, cough it out, cough it out. If it coughs out, that is great. But in a school setting situation, teachers do not hit a child on the back, especially in a school setting, because that can be considered child abuse. You can also put bruising on the back. Yes, we know as we were all growing up, yes, our parents used to hit us on the back. Yes, it worked. But the only way to do that in a home situation, if you wanted to do that, it's all right. Have the child raise their arms up, but let gravity work with you if you need to do that. But do not do it in a school situation. If the child is severely choking, then yes, hey, call 911, grab an AED, or come back. Or if you have your cell phone, then you dial 911, put it on speaker, follow the voice, and put the phone down next to you. Now, as the child is choking, severely choking, you're going to kneel down behind the child. As you kneel down behind that child's side, you're going to wrap your arms, either underneath the arms or over the arms, and you make a fist with your thumb side, and it goes right on the abdomen, just a finger width above the belly button is where you need to be. Then you take your other hand and place it over your fist. As a side view, this is what you are doing on the child, but you're just down to the level instead. Now, what we're going to be doing is abdominal thrusts. So what we're trying to do is build up pressure to get the object to expel out. But why a finger width above the belly button? Well, on the child's chest, as you can see, they have a diaphragm. They have the diaphragm, which is our breathing muscle. Now, in the air, in the lungs, you see there's still air residual in the lungs. So as we're doing our abdominal thrust, we're trying to do everything we can to go in and up to put pressure on the diaphragm, whatever air is left over in the lungs, to get the object to expel out. So with your hand placement on the child, make a fist, finger width right above the belly button, take your other hand, grasp your fist, and we provide inward and upward thrust on the child's abdomen. I'll go ahead and do a side demonstration, but we're going in, up, inward and upward thrust on the abdomen, just so hopefully the object what? Up and it expels out. If it expels out, then that's great. Hopefully the child starts to respond. But what happens now? You did everything you can, all the efforts to get the object to expel out, but it doesn't. Now the child's going to go unresponsive. Yes, get the child on a firm, flat surface. Yes, make sure we call 911. Get the help that you need. Before we do any compressions, we want to look in that child's mouth first before we can see anything. Now, we do not want to do any blind finger sweeps. Look in the mouth. If you're able to see it, the pinky is the only thing that's going to be able to get in that child's mouth and do a sweep, get around that cheek and gums there, and try and do a pinky sweep to try and remove the object. Now, that's only if you know that you can visibly see it and safely remove it. Otherwise, if not, you're going to start your compressions. Now, the depth of compression is that we are going to push hard, push deep, and push fast. Now, as I'm doing my compressions, I'm going to do 30. I stop. I look in the mouth again to see if I'm able to see an object. If I see it, remove it. Otherwise, if not, I'm going to temp my breath of air. So before I do that, why am I doing compressions? reason why I'm doing compressions is because when the child is laying on their back, their chest expands a little bit. And when I'm doing my compressions, I'm not just circulating blood and oxygen to that little child's brain, but I'm also able to put some pressure on the chest and the lungs itself. And with a couple of 911 calls that we ran on, that when bystander CPR or teacher CPR was doing compressions, it was just enough to get the object to pop out in the child's mouth. If you see it, remove it. If not, we tempt our breath of air. If our air goes in, we should be able to see the chest rise. That's a good thing. But if I give my breath and air just comes right back at you, sometimes you might have to reposition that airway again, give another breath. If air does not go in again, don't force the air. Go right back and continue doing 30 compressions. And after those compressions, look in the mouth again, give your breaths, and continue these procedures over and over again. Ladies and gentlemen, that is child choking. Thank you.